What You Need to Know About Iron by Jasmine, Omar, Victor, and Fernando.
Hey guys, my name is Fernando Baca, and the medication that my group received was iron. So the generic name for iron is ferrous sulfate. Some trade names are Ferrobob, Ferrosol, Feriron, Ferinsol, and Ferrosol. The classification for iron is iron supplements. The action of iron is that iron is an essential component in formation of hemoglobin, myoglobin, and enzymes. It promotes effective erythropoiesis and the transport and utilization of oxygen. Iron enters the bloodstream and is transported to the organs of the reticuloendothelial system that includes organs such as the liver, spleen, and bones, where iron is stored. Ferrous sulfate is also used for the prevention and treatment of iron deficiency anemia. The dosage range for iron deficiency anemia for adults/elderly is 65 to 200 milligrams per day in 2 to 3 divided doses PO. For the prevention of iron deficiency for adults/elderly, 30 to 60 milligrams per day PO. The usage of iron is contraindicated in patients that are hypersensitive to iron salts and that are hemochromatosis or have the hemolytic anemia disorder. Caution used for patients who have peptic ulcers, regional enteritis, ulcerative colitis, and patients who are receiving blood transfusions. Large doses to aggravate existing GI tract diseases. Severe iron poisoning occurs often in children, manifested as vomiting, severe abdominal pain, diarrhea, dehydration, followed by hyperventilation, pallor, cyanosis, and cardiovascular collapse. Some lab values that are affected with the intake of iron is that it may increase serum bilirubin and iron, and that it may decrease serum calcium.
Iron, also known as ferrous sulfate, the classification for iron is anti-anemic. So anti-anemic, it helps with treating and preventing the low levels of anemia in the blood. So it is essential for oxygen carrying and for the blood production in the blood. It is found in hemoglobin. So hemoglobin is the measurement of oxygen in red blood cells that carry oxygen from lungs to body organs. And without healthy red blood cells, it will cause the body to become too fatigued or tired. So if a person becomes too exhausted, it will affect their immune system, which will affect their ability to fight off infections. So in order for a person to increase their iron consumption, they have to acquire iron in their diet. That's the only way that will help preventing anemia in patients. And it is not only helpful for treating anemia in patients, but also in pregnant ladies.
However, some of the iron supplements side effects. Although taking iron supplements are known to be safe, however, some of the many side effects that can arise from iron supplements are the following: central nervous system, dizziness, fever, cardiovascular, chest pain, tachycardia, bradycardia, hypotensive reaction, hypertension, GI, nausea, constipation, dark stool, epigastric pain, abdominal pain, diarrhea, GI bleeding, temporary staining of teeth due to liquid preparation, side effects in patients with pre-existing health conditions, such as diabetes. There is a concern for women who are type 2 diabetes and are taking iron supplements, a possible side effect that can arise in this group. Risk of heart disease. It is important that you consult with your healthcare provider if diagnosed with diabetes. Heredity, hemorrhagic telangiectasia, HHT. Patients who are taking iron and are diagnosed with HHT should be cautioned when taking iron supplements as they are at risk for nosebleeds. Inflammatory bowel disease, ulcerative colitis, or Crohn's disease. Iron supplements might cause irritation and make these conditions worse. Use with caution. Precautions and contraindications of iron supplements. Use cautiously in peptic ulcer disease, ulcerative colitis, alcoholism, severe hepatic impairments, and severe renal impairment.
Drug interactions for iron oral supplements. Oral iron supplements decrease absorption of tetracyclines, biophosphonates, which are bone reabsorption inhibitors, fluoroquinolones, which are antibiotics, levothyroxine, which is a synthetic thyroid hormone, T4, mycophenolate mofetil, which is an immunosuppressive agent, and penicillamine, which is an immunosuppressive drug therapy, or it could be used for heavy metal as a heavy metal toxicity remedy.